So how do we investigate these patients? The tear film production has to be checked. The tear film stability has to be identified, and we also have to examine the ocular surface for any ocular surface disease. So the tear film production, how much of tear is being produced, is best evaluated using a Schirmer test. Schirmer's test is one of the most useful tests, and it is predominantly the method adopted for detection of tear film production. In almost all hospitals, we use Schirmer's eye test, whereas tear film stability is detected best with tear film breakup time, T-BUT it's called. So this is also a very useful test to identify the tear film stability, and the amount of ocular surface disease is best detected using corneal stains. So if dry eye disease has to be investigated thoroughly, we have to do a Schirmer's test, a tear breakup time, and a corneal stain in all these patients. So what you're seeing in this picture is the tear film breakup time. And classically, tear film breakup time is altered in aqueous tear deficiency and Meibomian-Glatt disease. So what you're seeing here is an eye which has been stained with fluorescent. This is the tear film height. You can see that the tear film height is decreased, and you can also see that these black areas are the dry spots. So the normal, if the ocular surface is normal, it will have this uniform greenish appearance. But in areas where fluorescent is absent, it usually indicates that the tear film is broken up. So what does it actually indicate? It indicates these random dots indicate dry areas. And how do we do this? We have to ask the patient to blink a couple of times, and by definition, it is the time between the last blink and the first randomly appearing dry spot. So you ask the patient to blink several times and then to open his eye. And then he does not close his eye or blink, and we examine the patient. So again, just to repeat, the definition of tear breakup time is the interval between the last blink and the first randomly appearing dry spot. So normally it is supposed to be less than 10 seconds. So that when a patient has a breakup time that occurs in less than 10 seconds, we consider that abnormal. So the next is Schirmer's test. So Schirmer's test is done using number 41 Whatman filter paper. So this is what Whatman filter paper is. You can see that this is supposed to be about 5 millimeters in width, and this 5 millimeter width is actually bent at the 5 millimeter mark and placed into the patient's eye. So you can see it's bent and placed into the patient's eye, and we ask the patient to gently close their eyes, and when the patient closes her eyes, you will have tears that come and wet this, and then it is removed at the end of 5 minutes and examined. So you can see here that there is a little bit of wetting, but it is just within 5 millimeter, which means that there is inadequate secretion. So inadequate secretion is defined as less than 5 millimeters of wetting, and there are two types of Schirmer test, type 1 and type 2. That is with anesthesia and without anesthesia is used, and most of the places we do type 1 or type 2 depending on the in order to identify the amount of production of tear film. Stains that we use commonly to look at the ocular surface can be rose Bengal, but in this context we also need to know about the other stains that are present, which is sodium fluorescent, rose Bengal, and lissamine green. Sodium fluorescent classically will highlight areas of epithelial breakdown, and it is most useful in patients for whom applanation tonometry is being performed in Jones test, in Siedel's test, tear breakup time, dry eye disease, and contact lens. And rose Bengal is used in patients when you want to identify dead or degenerative tissue, mucous strands, or when there is ocular surface disease such as what we're dealing with today, or in patients with dry eye or contact lens users. In all this, it is very useful. Lissamine green has the disadvantage of being it can be a little bit of an irritation to the patient's eye, but it's very useful to detect dead and degenerative tissue and mucous strands, and it is also very useful in dry eye and contact lens users.